Hi, this is Marco Rubio. Thank you for joining us today. I'm honored to be with Representative Paul Ryan to discuss the health care reform that's being talked about in Washington, D.C. that many of you have been reading about on the news and are rightfully concerned with. I'd like to turn it over for a few moments to Representative Ryan so he can update us on the status of what's happening and how we can, and we'd like to answer questions and then maybe make suggestions about how you can all get involved to stop what we believe to be a very bad plan for America and her future.
Well, thanks, Marco, and hey, I'm excited about what you're doing in Florida. I wish you the best of luck, and we're just so happy to see you get out there and run on the ideas that built this country. We are in the final moments of this bill. This thing is coming to a crescendo. Speaker Nancy Pelosi does not now have the votes to pass this, but she's narrowing the gap. At the beginning of the week, it looked like they were down about 15 to 20 votes. Now we think they're down about 7 to 10 votes. There are two pools of Democrats she's trying to get these votes from. One is, we call it the Stupak dozen. Those are the pro-life Democrats. Bart Stupak's the leader of them. We don't think they're moving. Bart Stupak is holding firm in opposing taxpayer funding of abortions, which this bill does do. Then there are a number of other Democrats that had voted no in the past. They're trying to flip to yes, and that is where the Speaker is trying to get her votes from. You go on HouseGOP.gov and you can find the list of those Democrats, some of whom are in Florida. I know Alan Boyd's one of them, and there's some other ones down there. Here's the story. On Saturday, they're going to bring up what we call the rule, where they are intending on deeming this thing into law on Sunday with a vote. Now, that just basically means they're trying to sneak this bill by the American people, get it into law, and get the president to sign it, and make some other changes, which actually adds to the burden of this bill. This bill, make no mistake about it, is really, in effect, a government takeover of our healthcare system. It is funded basically on about $500 billion of cuts to the Medicare program, which aren't designed to make Medicare more solvent, but to actually raid it from Medicare to spend on the creation of this new healthcare entitlement, in addition to about $500 billion in new tax increases. The only way they can make the numbers add up on this bill are to have 10 years of Medicare cuts and tax increases to pay for simply 6 years of spending in the bill. When you add this bill up, in reality, dollar for dollar, it doesn't make sense. It doesn't add up. It costs about $2.3 trillion. We believe this bill will create about a $460 billion deficit over the first 10 years and in excess of $1 trillion deficit over the second 10 years. What you're going to see in the news today is an analysis by the Congressional Budget Office that suggests this reduces the deficit over the medium and long term. I would simply tell people that the way the Congressional Budget Office works is whatever members of Congress give them to estimate, they have to estimate. And so you can manipulate a piece of legislation in order to get a predetermined outcome that looks good. And so what they're doing is that. They're disguising $371 billion of spending by putting it in additional legislation outside of this bill. And as I mentioned, 10 years of tax increases and Medicare cuts to pay for 6 years of spending just shows you the kinds of smokes and mirrors and gimmicks that are being employed to give this bill the illusion that it's an exercise in fiscal discipline. What this will do immediately, once enacted, was hit us with massive tax increases, which are bad for our economy, big Medicare cuts that the Medicare actuaries tell us will encourage or cause 20% of Medicare's providers to go out of business or just stop taking Medicare patients. And you're going to see lots of insurers have to dump people off of their insurance that they have right now because they will no longer afford to stay in business. So that more and more people must go on this government-run plan. And that is exactly the design of this system. We think it's probably the worst piece of legislation we've seen in years. It's the biggest social legislation to come through here in 40 years. They're distorting the process to bend the rules, to try and slam this thing through. They're doing that because Scott Brown won his election in Massachusetts. They can't govern and pass legislation the normal and regular way, so they're making up the rules as they go to try and jam it through against the will of the people, and they're trying to do this by Sunday. And with that, I just leave it up to anybody who wants to ask any questions.
Well, at this time, we'd like to invite individuals, participants, to press 0 on your phone keypad to ask a question or make a comment at any point. We've got the first question coming from Michelle, and it's regards to chances of passage. Michelle? Hello, Michelle? You're live on the phone. Please ask your question. Seems to be a faulty connection. We'll go to the next question. It's from Hampton, asking a question regarding Medicare. Hampton, Jordan?
Hi. I was wondering, how will this latest health care plan affect Medicare?
Well, it takes about $500 billion out of Medicare by cutting payments to hospitals. It's about about $135 billion are taken away from hospitals for treating Medicare patients, about $120 billion taken away from Medicare Advantage. 11 million seniors have Medicare Advantage. My mom, who's a resident of Lauderdale by the Sea, is on Medicare Advantage. They get hit. $15 billion taken out of nursing homes. The nursing homes are telling us that about a fifth of them will go out of business because of these cuts. You see it. There's actually a 21% cut in physician payments. There's a claim that will be made up in other legislation. But what we're hearing is more and more doctors will stop seeing Medicare patients. More hospitals will not be able to take them because of these cuts, because for every Medicare patient that comes in, a doctor's office, a hospital, or a nursing home, they start losing money. So it puts a lot of pressure on these providers to stop taking Medicare patients. And this basically takes $500 billion out of Medicare to create this other spending program. So people are familiar with the raid on the Social Security Trust Fund to pay for other government. Well, this is a brand new $500 billion raid on Medicare Trust Fund to pay for all this other government.
Thank you for that question. We'd like to remind folks just joining in to this Tele-Town Hall with Marco Rubio and Congressman Paul Ryan. If you have any questions or comments that you'd like to make, please press 0 on your phone key now. The next question we have is from Linda. Linda, you're on the line.
Oh, hi. I believe that the Republicans need to do more than just say no to the Obamacare and other Democratic ideas, Congressman Ryan. But what alternative solutions are being offered in Washington? And
I agree with you. No, I agree with you completely.
What kind of alternatives would you propose if you were elected?
Well, I am elected, and I have proposed alternative solutions. You can go to my website, house.gov/Ryan, and look at the Patient's Choice Act, or Google the Patient's Choice Act that I've offered with Senator Tom Coburn, Senator Richard Burr, and Congressman Devin Nunes, which gets us toward universal access to affordable health care. What we do is we create refundable tax credits and vouchers for people to buy health insurance, high-risk pools to subsidize people who have pre-existing conditions so they can get affordable care, interstate shopping so people can have more insurance competition so they can buy more affordable plans from states that have cheaper discounts, such as where I come from in Wisconsin, a medical liability reform to reduce the excessive costs in the healthcare system that is presented by defensive medicine. I can go on and on and on. The point is we've offered dozens of legislation as alternative proposals because we agree with you. It's not enough to just say no. We've got to put alternative proposals out there that fix these problems. And the point I would make, if you just look at the Patient's Choice Act or other bills that many of us have offered, is you can have universal access to affordable health insurance for all Americans. You can address the problem facing people with pre-existing conditions, and you can do all of this without a government takeover of health care, without $500 billion in new taxes, without $500 billion in Medicare cuts. You can do this if you do it the way we're proposing. And so the problem we've experienced is the media hasn't really reported much about our alternative ideas, and so a lot of folks just aren't aware of them. So thanks for asking the question. Please just Google the Patient's Choice Act or any of the other ideas we put out there and take a look at them.
Thank you for that question. And Congressman Ryan, I know we have time for one more. I know you have to get going. But we do want to remind folks that Mark will stay on the phone and continue this conversation with you a little bit after Congressman Ryan jumps off the call. The next question we have is from Tammy. Tammy, you are on the air.
Marco.
Yes, ma'am.
If the health care bill passes, do you support repealing the bill?
Absolutely. In fact, I would hope to be one of the I guarantee you if there's only one vote in the Senate to repeal it, it would be mine. I hope there'll be more. And I know that Representative Ryan would lead in that effort as well. But we'd like to actually prevent it from happening. And one of the things I'm going to encourage you guys to do who want this to stop from happening is to go on our website, marcorubio.com. We've started a petition called Scrap It. We're going to try to get as many signatures as we can on that petition before Friday, and then deliver it to our congressional delegation. In particular, a couple of members of that delegation in the House who have expressed uncertainty as to whether they're going to vote for it. Suzanne Cosmas, for example, is one of them. So I would ask everyone on this call who is opposed to this and would like to see it stopped to log on to marcorubio.com and sign our petition, because we're going to try to deliver that before the close of business Friday in hopes of convincing our delegation to vote against it.
I would just simply add Suzanne Cosmos and Alan Boyd are two of the Floridians that are on the fence that Nancy Pelosi is trying to turn to vote for this. They could provide the difference in this thing. And yes, our goal, especially if we take the majority, is H.R. 1 in the House and S1 in the Senate are repeal this law and replace it with something better like the Patient's Choice Act or other ideas that we've offered.
Right.
Thank you for that question. And Congressman Ryan, we know you're a busy man. Appreciate you joining us on this call. Folks on this call, we want to thank you for joining us. Marco will be continuing this conversation with you, so please stay on. But Congressman Ryan, we want to thank you for your time.
Let me just conclude. It is very busy up here, and I apologize. I've got to get going. But we need reinforcements up here in Washington. We need people who know that all the ideas don't come from Washington, who know that government taking over these huge sectors of our economy, whether it's healthcare or education or energy, is not the answer. And I just want to beg Floridians, send us Marco Rubio. We need people like Marco who have principles, who have conviction, who have know-how, who have proven track records of when the going gets tough, they don't go wobbly in the knees. We need reinforcements up here. And, Marco, I just want to thank you for getting involved and for running, and Godspeed, all right?
Thank you. Thank you,
Take care.
Ryan. Thanks for doing this.
Thank you. This call will continue now. I'm sorry,
we've got,
go ahead.
We've got about another 5 minutes on our window here, so we can take a few more phone calls, Alex.
Absolutely. The next question we have is from Chris regarding the Ryan roadmap and how it fits into healthcare. 1 second. Chris, you are on the air.
Hi. I had a question regarding. I've heard Congressman Ryan speak. It's not regarding entirely healthcare, but I've heard him speak in the past about the roadmap for the future. Can you tell us how this plan intends to handle our deficit and our national debt? And Mr. Rubio, do you support this roadmap?
I do. I think the elements of it, of course, he would even tell you, I support the roadmap. I think it's the most serious public policy proposal that's out there to deal with all of this. Obviously, once you put something like that through the legislative process, even better ideas will come up to improve on the ideas that are in it already. But it is by far the most serious proposal out there to deal with things like entitlement reform, things like freezing discretionary spending and getting federal spending under control, and dealing with things like entitlement reform, which it takes head-on, particularly in the Medicare and Social Security realm. And as he encouraged you to go on his website and learn more about the details of it. But I think it is, as I said and I repeat, it is the most serious public policy proposal out there to deal with what this country is facing right now from a fiscal standpoint.
Thank you for that question. We'd like to remind participants once again, if you have a question or comment that you would like to place, dial 0 on your phone key now. Next question we have is from Ashley. Ashley, you are on the air. Please go ahead.
Hi, Marco. My name's Ashley, and I own a small business. I have 7 employees right now. And I guess my question is, the biggest thing about this health care bill that scares me is, what can I expect? How is it going to affect my business? Now, in a couple years, what can I expect from this if it gets put through?
Well, it depends on the size and scope of your business, but clearly I think it's going to be a huge cost for many in small business for a lot of different reasons. I mean, it depends on how many people you hire. It could trigger a mandate. It could also trigger the need to pay fines if you don't offer a certain kind of coverage. It actually has some perverse, I don't think intended, but certainly perverse impact on businesses that have a high proportion of lower wage workers as well, because many of them are going to qualify for some of this assistance that will come through federal spending. So the bottom line is, I think the big picture thing that's brought to light by your question is the uncertainty surrounding the bill. It's the reason why process does matter. It's the reason why the President and this congressional leadership is wrong when they say that the procedural aspects of this don't matter. What matters is getting something done. we have a legislative process for a reason, and that's so that these bills and ideas can be openly discussed in the light of day, where multiple people get to look at it and discuss it and think about it over a long period of time. This is just getting rushed through without there being a full understanding of all of its impacts. And that's why, more than anything else, is the reason why we should be concerned. And it's probably the best way to finalize this call, because we've reached the end of our window, by asking all of you that are concerned about this bill. Maybe you're concerned about the bill because of what you know about it. Maybe you're concerned about the bill because of what you don't know about it. Both are valid concerns. And I would ask you that if you would like to see this thing scrapped, let's start from scratch on this whole idea of how to provide more cost-efficient, cost-effective, affordable health coverage for more Americans. If you'd like to see it start from scratch, then I ask you to log on to our website, marcorubio.com. Go on the website and sign the petition, a petition that we're going to make available to our congressional delegation here in Florida in the hopes of swaying a number of them to vote against it. And with that, I want to thank everyone who joined us in this conference call. We're going to be doing these periodically with key leaders from around the country on key issues. Obviously, we would love to have your vote on Election Day, both in the primary and the general election. But I also think the campaign could be an effective vehicle by which we could impact the process even now, even before we're elected. And this healthcare debate is one of those opportunities. So again, I encourage everyone listening to log on to marcorubio.com and click on our Scrap It petition and sign the petition so that we can turn that into our delegation and hopefully come up with at least two no votes that will help defeat this proposal.
Thank you, everybody. That concludes today's Tele-Town Hall with Marco Rubio and Congressman Ryan. We appreciate your time. At this point, we'll be concluding the call, but if you have any questions, comments, or concerns, we can patch you through to a voicemail at this time, and you can leave a message for Marco. And we appreciate it. Thank you very much.